Okay, Tim, let's start with what are your thoughts on what is family-centred practice?
Well, family-centred practice is a philosophy, a way of working with families. It's based upon designing services, basing services on what the families themselves see as being most important. It involves a partnership between the professionals and the parents. It involves taking into account the needs of the family as a whole, not just the individual child, whether it's a child with a disability or with a health problem or whatever. It involves building upon family strengths so that they actually get to learn how to do things, and it involves helping them learn how to use all the resources they have at their disposal. So it's a general all-purpose way of working with families. It's how services are delivered as opposed to what is delivered. Family-centred practice has been around a long time. Its statements and philosophy were first expressed 25, 30 years ago and so on, and evidence has continued to support them as being critical for effective service delivery. So one of the reasons why it's important is that you get better results if you use family-centred practice. We haven't really talked enough about, I think, is the issue of taking into account the whole family.
Mm-hmm. Yeah.
This is an important aspect of family-centred practice. The child is most definitely the focus. They're the reason we're there. They're what we're trying to benefit. But what we understand is that how well a child functions depends on how well the whole family functions. Anything that happens to the child is going to affect the family. Anything that happens to the family is going to affect the child. So we need to be concerned about the family as a whole, and indeed about the family's circumstances.